Section we will check the ICD and CM official guidelines for the medical coding and reporting. So where we will check in that just overview of the ICD and CM. So ICD and CM is the International Classification of Disease 10th Revision Clinical Modification. That guidelines have been approved by the four organizations that make up of cooperating parties for the ICD-10-CM, the American Hospital Association and the American Health Information Management Association. Also CMS and NCHS. CMS it means the Center for Medicare and Medicaid Services and National Center for the Health Statistics. These two departments within the US federal government they are cover all of this the ICD-10-CM and World Health Organization published this classification of disease. So every first October in ICD-10-CM added some new codes, delete some codes and some codes are revised. Basically in ICD-10-CM there are four quarter updates. It means the new updated guidelines released by the AHA coding clinic. It's vary to pronounce organization to organization. Some organization known as the coding clinic, some organization says the age updates. So basically we will see in that session just a overview of the ICD-10-CM index. What will we see in the ICD-10-CM? Just overview in it. So firstly in ICD-10-CM official guidelines there are four sections and first section covering the three parts and first section is a major part of the ICD-10-CM. Other are the remaining just basic overview thinking in the, what will you see in the patient report. So in section first there is the convection, general coding guidelines and chapter specific guidelines. These are the major part. So first in the convection it's general. We will see in that alphabetical index, tabular list, what is format structure, what is place folder, what is 7 characters, many abbreviations used in alphabetic index as well as tabular list, where to use punctuation mark, where to use and what is the concept of other and unspecified codes, what is the terms, includes, exclusion, inclusion, etiology, manifestation. Where to use and with see also, code also, default codes. That's all terms we will see in the part first, convection. Second part B we will see in general coding guidelines. Basically we will receive the patient report that time, what we will check in that report. So this all parts cover in the part B section. Here is majorly we will check in the patient condition, that is what is the acute condition, what is chronic condition, how to find this, where to code signs or symptoms, how to code specific code you check in the laterality, laterality and specificity how to check. After that we will see in the borderline diagnosis, sign and symptoms and their adverse effect and side effect codes. In that external cause of morbidity or many more external causes having patient, this also covering in that. Also we will cover in that section with Z codes. Third one part in the section first is a chapter specific coding guidelines. Basically in chapter specific coding guideline divided by the body system and it's alphabetically ascending order codes. So First chapter start from the A alphabet to last chapter end as the Z alphabet. It's the ascending order only. So in chapter specific coding guidelines we will see in the first chapter certain infection and parasitic disease. So in that chapter we will cover all infectious disease and parasitic disease. Their series is the A002B99. Also use EU07.1 and U09.9. You will see that code it's assuming is very difficult, but it's not, it's very easy and you can only search in software and put it down that code in the your software. So second chapter is neoplasm, that is cancer. Third chapter is a disease of blood and blood forming agents and certain disorder involving in the immune mechanism. Sorry. Fourth one chapter is a endocrine, nutritional and metabolic disorder. That's the DM and obesity. Chapter number 5 we will cover the mental, behavioral and neurodevelopmental disorder. Chapter number 6 we will cover the disease of nervous system. Chapter number 7 we will see disease of eye and adnexa. Chapter number 8 is the disease of ear and mastoid process. Chapter number 9 disease of circulatory system. Chapter number 10 disease of respiratory system. Chapter number 11 disease of digestive system. Chapter number 12 disease of skin and subcutaneous tissue. Chapter number 13 disease of musculoskeletal system and connective tissue. Chapter number 14 disease of genitourinary system. Chapter number 15 pregnancy, childbirth and puerperam. Chapter number 16 we will see the certain condition originating in the perinatal period. Chapter number 17 is a congenital malformation, deformation and chromosomal abnormalities. Chapter number 18 that is the symptoms, signs and abnormal clinical and laboratory findings not elsewhere classified. Chapter number 19 injury, poisoning and certain other consequences of external cause. Chapter number 20 external cause of morbidity. Chapter number 21 factors influencing health status and contact with the health services. Z code is also included in that. And chapter number 22 is a new chapter adding in the ICD-10 as a code for special purposes. After COVID, this chapter will added. So next section is the selection of principal diagnosis. In that section, how to deal with patient report by using the ICD-10 codes. Basically, we will see in that section. Section number 3, reporting additional diagnosis. It means you can see in the abnormal findings, previous condition, that is past medical history, certain uncertain diagnosis we will see in that section. Section number 4, and this is the last section, diagnostic coding and reporting guidelines for the outpatient service. So in that section, basically we also life science students, so we will know without laboratory we can't get findings to detect disease and disorder. So basically in OP or observation care or any stay, we will check the laboratory findings. It's not complicated, basically directly mentioned in the report. These findings is mentioned, so we can check in the ICD-10 and code it. So basically these 4 sections are in HCC medical coding or ICD-10. Major part of section first because it covers all guidelines remaining 3 are minor part. So in ICD-10CM, these guidelines have been approved by 4 organizations or cooperating parties in US federal government. First one is the AHA, that is American Hospital Association. Second one is American Health Information Management Association, that is AHIMA. Third one is Center for Medicare and Medicaid Services, CMS. Fourth one is NCHS, that is National Center for Health Statistics. This all department within the US federal government have been approved and they create the ICD-10-CM guidelines as well as code and published by the World Health Organization. So this is the overview and index for the ICD-10-CM. We will start the ICD-10-CM ascendingly. That's why you are understanding all the concepts and it's very easy. So thank you so much guys. We will